So welcome Victoria to your topics.
بسم الله الرحمن الرحيم رفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير.
I'm happy to be with you today. This is my first time visit Balbáḥة city, and I thank the conference organizing committee, especially Mr. بالباحة and Ms. Haifa, and thank you so much all each attendance and greetings. Thank you. Now I start my presentation. My presentation topic, communication and psychosis. It is going to do what have. Some people, when you see for this topic, you say, oh, communication, it is not updating now. There is updating subject or topics in psychiatry more and more. But the researcher found that the psychiatric nursing unable to provide nursing intervention, treatment, either medication or psychotherapy, except until to able to building successful communication or severe communication with psychotic patient. Communication and psychosis, it is good to know what happens. Communication between nurses and patient is at the heart of psychiatric practice, and particularly challenging with psychotic patient. It may influence patient outcome indirectly. Effective communication may have an effect on patient engaging in treatment in the first place, following treatment suggestion, satisfaction, referral, or other services. But there is no definitive model for good communication. Unable to put our instinct, our ignorance work in psychiatric nursing or psychiatric hospital, I would say it is a model for good communication. The responsibility of psychiatric nurse is not just of the root cause will help in finding an effective solution at the earliest. And the theoretical communication is the ideal tool for identifying the problem. The psychiatric nurse, as a part of the theoretical communication process, need to listen alongside with the patient and other family members of the patient. Also, psychiatric nurses not care only patient, but other members of family, because to get health education or present of behavior therapy, individual therapy, family therapy. Talk in a polite way and measured words that instill the sense of confidence and the trust of the patient. So, we should know about the therapeutic communication. Therapeutic communication is a planned process of interaction, not haphazard communication, but planned. Planned process of interaction in which the nurse demonstrates empathy, use effective communication skills, and respond to the client's thoughts and needs. Communication process. Sender, we need to communicate, send a message to receiver. This message may be verbal or non-verbal. The receiver responds and sends feedback to receiver. This is the communication process. Okay, now what are the components of communication process? It includes sender or encoder. Encoder, person sending the message. A channel is the method of communication that includes verbal and non-verbal communication. Receiver or decoder gives the message. Communication skills include being able to observe, listen, clarify, validate by both sender and receiver. Second, where communication takes place. Feedback on what is the continuous interpreting of response of sender and receiver. Environment. Environment are the internal and external influencing the communication process. External example, room temperature, smell, and light. Internal example, feeling cold, tired, experience of pain. All this affects the communication. Now, type of communication. Verbal and non-verbal. Verbal communication is or writing. Maybe telephone, calling with telephone, it is communication. Chat is a communication. Verbal communication. Writing is a communication. Verbal communication. Non-verbal communication. Non-verbal communication is very important. It is important more than verbal communication. Non-verbal means the tone of voice. Tone of voice for the nurse and patient. For the tone of voice of the patient may be assist the patient. If calm, agitated, loud, soft, fast, slow, for this tone of voice may be assist the patient. Volume of speech, stream of talk. For stream of talk also are able to assist the patient. Body movement, general posture, head nodding, hand a helpful way. Also, psychotic patients have disorder in motion, cognition, behavior. In emotion, maybe say or find the patient happy, depressed, anger, anxiety, fear, apathy, and I will need to deal with this, all this person or all this patient in the same unit or in the same world. And everyone needs special communication. Information, we find hallucination. Hallucination is visual, auditory hallucination, tactile hallucination, delusion. Delusion, many types of delusion. Every type you need a communication. It shares or different from one to one. Circumstantiality, looseness of association. This is an example. The behavior may find withdrawal patient or aggressive patient. So it is difficult to deal with all these symptoms. So should we know now what is the communication technique should be used when you deal with psychiatric patient. Okay, if the nurse assess the patient or communicate with the patient, what you will need is skills to facilitate patient expression. I need a patient express the feeling. How? I use techniques as active listening. Listening is very important. The normal person complains for no one listen me. Or you like to talk, but no one listens. Okay? Psychotic patient need who listen or active listening. So active listening has a characterized. The nurse who is actively listening observe non-verbal communication. Think along with the patient and respond appropriately. Okay? How to be active listening? To be active listening should be you are listening through eye contact. Show your attention by avoiding distraction movement. Change the facial expression in according with the topic and personal reaction. Not the patient complain from sadness, depression, and anxious, or smile. This is loss of trust. Block communication. Listen without evaluating. Oh, it is good, it is bad. Oh. By seeing the situation as other person see it, not I see it. Use validation and receive what you heard and ask. Did I hear and understand you correctly? Number two, first one, active listening to help the patient to express his feeling, emotion, complaint. Number one is active listening. Number two, question. How to question the patient? Questions may be why, how, when. It is important to begin with what, who, when, to give factual information. This is a fact. When you respond with the facts. But why and how question should be limited as they require analytic ability and information which is the patient does not have recall. Maybe use why and how in the end of a relationship after the patient build trust between the patient and nurse. To stimulate and increase communication, allow you asking the questions which may be answered without one word. As example, this, my goal is the same, or my question was the same thing. Silence. Silence, it is very important also. Also, silence may interfere with the communication, yet is it active tool. Silence means that both sender and receiver not talking. Silence serves a variety of purposes. On the part of the patient, it may attempt to think or recall information. On the part of the nurse, it may indicate acceptance, understanding, and interest in the hearing. When you sit with withdrawal patient, depressed patient, he refuses to talk. Is unique person. So when the nurse sits with the patient and good silence means I accept you. I sit with you without conversation or without communication. Giving phone opening. When you talk phone opening, there are which will encourage the client to talk. How? When you ask the patient and the patient talk, maybe say, what would you like to discuss? What are you thinking about? Tell me about yourself. This giving opening. Broad opening is what open questions. Generally, encourage client to continue elaborate examples, go on, and then tell me about it. Yeah, I see. Empathy. Empathy is the ability to see things from the other person's perception and to communicate this understanding to other person. Empathy includes accurate perception of the patient by the nurse, communication of the understanding to the patient perception of the nurse's understanding. Example, I can hear how painful it is for you to talk about this. When you say I can hear, not I can feel. I hear means I hear your problem and I try to solve this problem. But when you say I feel means sympathy. I can with you that maybe not intervention or get solving to your problem. Okay, first skills for expression of the patient. Another skill, understanding client expression. I give the patient chance for expression, but now how understanding this expression? Number one, restatement. If the repeating what the patient has said in knowing the same word he has used. Patient say, I don't sleep, I stay awake all night. Nurse, you stay awake all night? When you say the patient or repeat the same, which I listen to you, but complete. I need understand. Paraphrasing. This is another technique for understanding the patient. This is repeating the ideas that the patient expressed in different words. I can't sleep. I stay awake all night. Nurse, you have difficulty sleeping? That provides empathy to the patient. I listen to you and I help you. Reflecting. It is directing into the back of the patient's questions, feeling, or ideas. Patient say, do you think I should tell the doctor? Yes, you look tired. Clarify, trying to clear up confusion about events or people. This nurse asks specific questions until the information is completely understood. I'm not sure. I understand what you baseline, develop self-awareness. This is a third technique or skills patient developing awareness. When the patient, psychotic patient, talk with the nurses, you change from idea to other. Patients who have flight of idea, who have circumstantiality, so the nurse not be listen a lot of time, all of time, but you need focus of talk with the patient to help the patient how to communicate. Not all time I able to stay with the patient. Focusing the concentration on single important point. This point seems more looking at more closely. You said something earlier that I want you to go back. ممكن علشان أرجع patient to another subject. Integrating, giving meaning to what the patient is saying. Example, the sound as exists is very important to you. Or you seem to get in trouble when you talk about what is confronting, helping the patient become more aware of inconsistency in his or her feeling, attitude, beliefs, and behavior, only to be used after trust. Confronting used after the building trust between nurse and patient. Should be done gently with sensitivity. Example, you see you have already decided what to do, yet you are still talking a lot about your options. Summarizing may be used on the patient and the nurse. The nurse maybe help the patient to summarize the conversation or information, and the nurse summarize to show that patient understand. Organizing key issues that have been discussed. Voicing it out. Voicing it out, gently questioning the client idea or perception. This method or this skills may be used with schizophrenic patient or deluded patient. When you say a lot of things, not reality, maybe say, really? Are you sure? Is only way to integrate it? That's hard to believe. Another skill, helping client control behavior. Okay, I accept the patient all the time, but sometimes the patient needs to control. First one, setting limit. Example, spitting on the floor is not accepted. Put limit setting. Positive enforcement. If patient change your behavior, should be given positive enforcement. Giving information. Patient needs to give information about disease, medication, prevention, rules. Okay? How to effective stereotypical communication skills with some psychotic symptoms. Some psychotic symptoms and talk about how to communicate. With consideration, this is not nursing intervention for each psychotic symptom, but only how to communicate with these symptoms. Apathy and or withdrawal. Patient is not getting seen them to describe it, but instead to observe, recognize, acknowledge, respect, try to understand it. Tolerating silence. Now, use silence technique to help the patient. This is critical expressing the patient. While are not alone in their personal whole. In regard to delusion, nurse response reflected the fact that patient had a need to talk about their delusion. So, giving them that space to talk about them and to feel that you are actually listening to them. Accepting and listening to delusion material is a way to understanding of the patient and their experience. Delusion symptoms or delusion, all patient means forced belief that not connected by logic, and it is fixed, so it is difficult to change or to talk about the delusion or arguing delusion or contradicting for delusion. Learning what actually means perceive and understanding how the delusion system may have a protective function. It requires less to ask about how the delusion started, how it is believed, what sense they make of it, how it is related to their background and culture, what might be the idea where what comes from, not arguing with them that their delusion will force slightly child, which may be used as when did they do it, how did they do it, why did other people do this. There is something that blocks of communication. When you communicate with the patient, communication may be stopped or blocked. When changing the subject of communication, the patient complains or discuss about his problem, and suddenly I change this problem, or I change this conversation, or I talk about a nice environment, or anything. Stating one's personal opinion and idea about the patient and his situation. Giving false or inappropriate assurance. Jumping to conclusion. Offering solution to problem or giving advice. Distraction in the environment such as loud voice. Summary. I talked about cellular communication, type of communication, communication technique, also communication with psychotic symptoms, and lot of communication. Thank you.
Any question to Dr. Hala, especially from the nurses investigating the hospital?
Any questions? Okay.
The mic is there.
without aggravating his condition.
Confronting the patient means confronting his behavior. If the patient has behavior or aggressive behavior and deny it, I confront him with this behavior. It is not acceptable.
He may become more violent.
Violent? No. If have violent, each surgical technique should be used in the acceptable situation. So to do something positive to the patient. This is the new trend, to do something positive to the patient, not to don't harm the patient, but you must do something positive to the patient in all sectors of health and in all branches of nursing. This is the image that we are looking for. Thanks for all, and let us to see some captions.
Or mediastinal cavity to better understand how a chest drain works and contributes to a patient's recovery. Let's review the chest anatomy and physiology and the mechanics of breathing. The chest wall is composed of the ribs, sternum, and thoracic vertebrae. All are interlaced and covered with intercostal muscle to form a semi-rigid structure. The lower boundary or floor of the thoracic cavity is known as the diaphragm, which is also composed of muscle. The interior of the thoracic cavity can be divided into three distinct areas, the mediastinum and two separate chambers for each lung. The inside of the rib cage is lined by a membrane called the parietal pleura, while the lungs are covered by another membrane called the pulmonary or visceral pleura. Under normal conditions, these two pleural surfaces are closely held to one another, being separated only by a very thin film of lubricating fluid called pleural fluid. The pleural fluid keeps the two pleural surfaces in contact, while allowing them to slide smoothly over one another during breathing. The presence of negative pressure, or vacuum, between these two membranes is what helps hold the visceral pleura in close contact with the parietal pleura at all times. During respiration, air moves in and out of the lungs in response to changes in intrapleural pressure caused by movement of the diaphragm and chest wall. Under normal conditions, there is always negative pressure in the pleural cavity. The degree of negativity changes by respiration. When air, fluid, or blood enters the space between these two membranes, the space created is known as a pleural space. This is an abnormal occurrence and results in labored breathing. When the chest wall is opened either by surgery or chest injury, the inrush of air causes the vacuum in the patient's pleural cavity to escape. Since the normal negative pressure or vacuum is no longer present, the lungs may partially or fully collapse, as they depend upon this negativity or vacuum to stay fully expanded. Without full lung expansion, the patient experiences pain and great difficulty in breathing. If air accumulates in the pleural space and has no means to escape, pressure within this space can rise significantly. This is known as a tension pneumothorax, and can result in a potentially life-threatening situation known as a mediastinal shift. That's where the chest tube and chest drainage system come in. To restore the chest to its normal condition, all air and fluid must be removed. The purpose of any chest drainage device is to help reestablish normal vacuum pressures by removing air or fluid in a closed one-way fashion. For pneumothorax, the chest tube is typically placed anteriorly near the lung's apex. For a hemothorax or pleural effusion, the chest tube is placed more laterally in the lower part of the chest to facilitate more efficient fluid drainage. Frequently, two catheters are inserted. The need for chest drainage is also required following open heart surgery or chest trauma to evacuate any pooling blood, which, if left in the mediastinal cavity, can cause cardiac distress or tamponade. As you can see, chest drainage is indeed a life-saving procedure, and one of the most important services a physician and nurse clinician can render.
Thank you, Doctora, for your very good and very interesting lecture. Before I go to the next speaker, I just want to see wake up people, because what I can see here is all of you are sleeping and not listening at all. Please, you know what kind of feelings will have the speaker will have when he will say, the attendants are all, sleeping and not curious to follow and to communicate with him. Please be awake and be with our speakers. Now we will call again Dr. Hanan Muhammad. She is a doctor in surgical and medical nursing. She is from Al-Baha University. So welcome, Doctor. She will talk about
with advances in the antibiotic and surgical techniques. But more recently, Community renewed interest in the use of maggots was established in the early 2003. This is for the purpose of supporting patient care, education, and research into maggot therapy. And now, what maggots? Maggots are fly larvae. The larva work continually to remove the dead tissue and cleanse it from bacteria while leaving the viable cells alone. Infestation of the maggots in humans is known as meiosis, but meiosis may be beneficial or harmful, this depending on the type of maggot and the circumstances surrounding infestation. In the medicine situation, the beneficial meiosis is known as maggot debridement therapy. So, what about maggot debridement therapy? This is maggot dressing, not conventional dressing with antiseptic solution. Now we speak about meiosis. Meiosis producing the flies. First, I want to give you a simple feedback regarding meiosis, either beneficial or harmful. We have two main families of flies, California and Salmonella. or fish or on occasional wound, not directly on the wound, but prepared as the first step. And then the exact take the duration from 8 to 12 hours. Prepare the egg until to convert to larva. This larva take duration from 4 to 8 days, and then convert to pupa. This pupa take duration from 6 to 14 days, and then converted again to adult to be feeding and give again eggs. So which cycle, which stage during the cycle is important for us for macrobial therapy is larva. So as I mentioned, we have 3 beneficial larvae, Luciella, Califora, and Sarcophagus. And now, what the medical importance? As we mentioned, these larvae cause little, no damage as they feed on necrotic tissue. Larvae feed mainly on mass, not much damage. And the removal is easy. And really impair healthy tissue because it's not feeding on viral cells. And now, if all patients with wound need to be used macrobiotic therapy, the first indication, larval therapy can eliminate wound infection and odor from extensive necrotic wound. Also can feeding at the edge of ulcerated wound on foot. Also can cleaning up a wound associated with amputation. Also macrobiotic therapy can also indicate for the debridement of a non-healing, chronic non-healing wound with the necrosis of skin or deep tissues like pressure ulcers. Pressure ulcers, foot ulcers, specific diabetic foot patients. So, macrobiotic therapy of this larva is important for medical field or not yet, importance to health care is to remove necrotic flesh, antimicrobial properties, and by this way promote wound healing. And now, what the mechanism of action? How can this larva eat or feeding the necrotic tissue? Its effect is to aid this larva to debridement of wounds for the necrotic and infected tissue. This infects the wound by excreting substances that inhibit or kill infecting bacteria and by this way accelerate wound healing. For example, if we see this diabetic foot or ulcer in the leg, we put this larva, the larva producing proteolytic digestive enzyme which liquefy the necrotic tissues under the physical actions of the mouth of this larva and eat by tearing of this secreted tissue and eating this tissue. And now, how can we repair this larva? Macrophore medicine use, as the first egg must be sterilized. And when become larva must be sterilized with radiation. Before being used, so that they will not be able to convert from larva to pupa stage. Description and natural history HY of vegetal mammals. These larvae, after fermentation by a specific way, put in vial. The vial of many vegetal mammals contain approximately 1,000 Luciella. Each vial also contains both and dried food. يعني both bed have soy proteins. For this larva to be feeding on it, to be complete survive until to complete from 4 to 8 days, as we mentioned before. So what about storage and handling? Medical mammals should be used within 24 hours of receiving and optimal viability. As we see here from the vial, we can see the good bed down of the vial and also crowding up of this larva inside of this vial under the effect of temperature. As كل ما which will increase temperature, it is the metabolism and effects. But we have warning for using medical maggots. The first one, the vial is not designed for multiple using. This means that just open this vial, must use all maggots according to indications for the wound. But actually, remaining of maggots must discard all. And the maggots may not be applied more than once. Second, used maggots must be handled as a contaminated medical work. This means that if we have remaining digital maggots, we must be put in red bag with double package and put in autoclave to kill these maggots. So what about unused? As I told you now, must be destroyed by this way. Every batch of digital maggots is captured during production to ensure sterility. Also the care of this vial. If losing or broken, must also reduce all the vial. But also, what about the warning for the patient? This side effect which can cause to reducing for the patient. First one, allergic reaction for the patients. Also, medical maggots can cause pain or discomfort. One should never be allowed to close over the maggots because this can lead the maggots to be suffocated. Patients with fever or change in mental status should be evaluated for severity of infection. And also medical maggots should not be allowed to remain in the wound with the eyelid. All the patients can use medical maggot therapy? Of course not. So we have some patients can't use this maggot therapy. First, patients with acute, rapidly advancing, life or life-threatening infections should not be treated with maggots. Second, maggot therapy is not indicated as a primary treatment for infected bone or tendons because as we mentioned before, it is not used in invasive wound or internal organs. For G wound, no. Patients whose circulatory integrity is compromised to the extent that wound has minimal chances of healing because it's used for using. This maggot development therapy causes mild bleeding, so it is contraindicated for patients with the tendency for bleeding. And at the end, sure, as we mentioned, digital maggots should not be given unlimited access to deep organs and tissue. So now, what about the dose and the administration? The recommended dose of digital maggots is 5 to 8 per centimeter of bone surface. Applied topical. If the eggs are brown, the maggots may have dead during chilling. So, what the normal color of larva or this maggot? It is yellow in color. But when it becomes brown, by this way it is contraindicated to use. And now, how to apply maggot debridement therapy? Liquid adhesive for the adhesion to the layer. For the fourth step, larvae can be transferred from container by leaving them off the side of the vial with a dry water or saline moisten the gold there and place maggots on the wand. The fifth step is a little light dose if necessary, but light, not heavy. Why? To prevent the larva to suffocate. And also to cover the wand, but don't bag the wand with gauze. Because when you got the gauze and try to bag, by this way you bag with maggots and maybe escape from you. Then quickly cover with tape. And the last step, top the cage for dressing with light absorbent gauze and don't use a lot of absorbent because it will prevent air entry and suffocate the maggots and also add lightly to pieces of tape. For changing, how many times? This maggot dressing يعني similar to conventional dressing must change. How many times to change? What duration to take to change this dressing must take from 4 to 8 hours, this depending on the type of wound and amount of drainage. And now we want to remove the dressing with maggots. To remove the maggot dressing, loosen the maggot dressing from the patient's skin. Remove the maggot dressing, loosen and this by hand. And then beat back the dressing with one hand while beating the maggot with the whole bag held in another hand. And unreaching the maggot between the two hands. And after that, discard the maggots as any potential infectious dressing was, which means discard in red bags and securely seal to prevent escape. What about the duration of maggot therapy? The total number of cycles depending on size and type of wound and also depending on the goal of therapy, decision of doctor, but most ulcers are completely deprived from 1 to 6 cycles. And now I will play video to see how this maggot works. This larva, as we mentioned before, طبعا دي 1, but as we mentioned, a lot of number according to the body or according to the surface of the wound. And these two opening as necrotic tissues, and the larva try to extract to, as we mentioned, to producing a fulfilled digestive enzyme and feeding digestion of this necrotic tissue. And now we see a clinical study have an experience with this maggot debriding therapy.
Ms. Pam Mitchell, I've been a diabetic 41 years since the age of 10, and that led to my diabetic ulcers on my feet. I had a stage 4 ulcer on my left foot. The doctors wanted to amputate my feet. They had tried numerous IV antibiotics over
This is the heel of the patient. Have pressure ulcer in heel of the
oasis, warm-up therapy, and numerous treatments, debridement creams, and nothing worked. The doctors told me to think about amputation. By chance, a friend was watching the Learning Channel, and she saw megatherapy that they use in Europe and what great results they have. I asked my doctors about the megatherapy. They told me that it wouldn't work for me, that my ulcer was too deep, and because I had osteomyelitis. After the doctor did surgery and it treated my wound, I had an ulcer that was about 1 inch deep, 2 inches around, with a ½ inch of exposed bone. A couple doctors told me to give it up, have my foot amputated, and see a psychologist. I didn't think I needed to see a psychologist. I just wanted my doctors to do everything they could do to save my feet. I kept asking and pushing the doctors to do it, and they sent in a doctor that had done it one other time before on a patient whose wound was not as bad as mine. He came in, looked at me, my foot, talked to me, asked me what I expected the negatives to do. And I wasn't really sure. I just knew that I wanted to try it, that I was willing to try anything. And we talked about them just cleaning up the infection, that we had no idea what they could do. And I had to go to my dermatologist's office. He put the maggots in his office. They stayed in for 2 days. My orthopedic surgeon took them out in his office, and he was amazed. They worked on the bone, they were cleaning up the infection. He was just totally amazed how they were clearing up the infection. At the time, I had gotten a rare bone marrow disease, myelodysplasia, from one of the antibiotics I was on. They didn't know that was a side effect at the time. I was very sick. My blood count had gone down to 6. I was gray. I lost half my hair. They had sent me to Cleveland Clinic. They were planning on doing a bone marrow transplant. They had tested both my brothers to see if they could be donors, which they could. And I was hoping for a miracle, and the maggots did that. They actually got rid of the osteomyelitis. They took me out the antibiotics, and the myelodysplasia cleared up. The maggots totally healed my wound to very small. I had used chromosomes and completely, but the maggots did a miracle. And I highly recommend to anybody, to any doctor, to try before amputating a patient's limbs. They actually, maggots saved not only my feet, but they saved my life. I did take some harassment, but it was worth it. I did have some discomfort because I do have feeling in my feet still, and I wouldn't think twice about using maggot therapy again.
Thank you for this contact.
Thanks, Dr. Hamad, for this introduction. Now, on behalf of Dr. Hilal Ali, Dr. Nihal will give us lecture about moving ideas in overview and the scientific update. So, once again, welcome to Korea.
We meet again, and I thank all of you for this time to attend until now. After also lunch, it's difficult to listen for discussions. My presentations about emergency department triage system. In fact, this topic is suitable for all specialties, medical, surgical, gynae, pediatric, and all we need for